One of the most sensitive issues surrounding breast cancer is that of body image. It's important to check in with yourself after surgery. Do you feel okay with yourself? Do you still feel attractive, positive about your appearance? And for women with partners, do you feel comfortable enough to reestablish sexual intimacy again? Because treatments for breast cancer can be robber barons of so many parts of ourselves. It affects our daily lives, our work, our relationship with our children, family members and friends, and our own emotional and spiritual well-being. And if we have a partner, it affects our communication with that partner and his or her understanding of us in a new context as a cancer patient. The aftermath of surgery and or the treatment also play havoc with our perception of ourselves as women in relation to what we see in the mirror or feel deep inside. And of course, the physical side effects of the treatment itself also affect sexual intimacy, in addition to those emotional scars we'll be carrying. In talking with experts who specialize in helping patients with self-image and sexual recovery, one of the things that most of them advise is this: if your physician or oncologist is reticent about discussing these subjects, appears uncomfortable or kind of ignores them, ask for a referral for someone who is open to such discussions, because every woman is affected in some way from breast cancer and its aftermath. Yet, it's not so easy for the patient to talk about it either. Many women find it difficult to wrap words around some of their feelings concerning sexuality, sexual recovery, and sexual expression, because often a woman's body is so changed by an external experience like surgery or a course of radiation treatment or chemotherapy. And then on top of that, women are often socialized to have so many negative feelings about their bodies to begin with. So for some women, dealing with the scars of surgery just reaches in and pulls out every negative feeling they ever had about their bodies in the first place. Then there's the grieving about all those changes, which stirs up yet another set of associated feelings. And of course, where do you go with that one? Should your well-meaning family, be saying to you, cheer up, be grateful that you made it through the surgery, or you're going to be just fine. And of course, people say such things because, yes, they care about you, but, there's also this part of them that's likely very scared with the fact that they could lose you. So rather than see you unhappy, they rather sort of encourage you to plaster a smile on your face and have you think that you're going to be okay. And of course, you'll really will be okay someday, but you're not yet. And the reality is that it sure doesn't feel like it anytime soon, at least not today. So rather than comply and plaster the I am okay look on your face and swallow that pain, avoid your grief, your sense of loss, please find help, because people who avoid such pain eventually have to face up to the fact that the pain's still there, and so is the loss. The roots of your sexual recovery will require nothing less than coming to terms with your altered body in a way that you can accept it at some deeper level. And your ultimate goal is to discover the best way for you to feel more whole or complete in a different way, or at the very least to come to terms with what might be a long-lasting feeling of incompleteness for you, regardless of how you try to reframe it. But hopefully you will emerge with a certain sense of being changed in other ways, of being wiser, stronger, and more understanding of everything in life, so you can get more from life.